Um, and or let Janice or Will know if you have a question or raise your hand or feel free to just ask as we kind of go along. I welcome questions. I welcome comments, opinions. And so please feel free if there's a thought or something that comes up for you as we're kind of going through this information, please feel free to chime in. All right, so I am going to go ahead and go on to what we're going to be covering this afternoon. All right, so the first and foremost thing we're going to be talking about is executive functioning. I will be touching a little bit on the brain region that is responsible for those executive functioning skills that we have, and how injuries to that part of the brain can kind of result in some executive functioning impairments. We're going to be talking a lot on organization today. And so, in order to be organized, we need to be able to plan. We need to be able to have a system or a goal. So, we will be touching on SMART goals. I'm sure many of you are familiar with that acronym, but we will be touching on just ways to kind of figure out how to navigate goal setting and the steps that are involved to kind of achieve what we want. Um, Going along with organization, there's often many challenges that come with setbacks, feeling overwhelmed, not having the motivation to get stuff done. And so we're going to be touching on that a little bit, with how do you manage setbacks? When you have a plan, when you have something you want to accomplish and things aren't going well, and you're hitting a bunch of obstacles, or you're just struggling with maybe mood or energy and it's getting in the way, how do we navigate that? We will also be focusing on technology that helps to not only improve organization and routine in our day-to-day life, but I'm going to be talking about some apps that exist, not just brain training apps, but also apps that exist to improve goal setting, organization, and even executive functioning skills. I have left time at the end of today for what I call a troubleshooting session, where if people feel comfortable and they want to share their own maybe challenges or goals that they have and they can't figure out how to get, from point A to point B, or maybe they have a family member in their own life, or maybe even a son or a daughter that's having some executive functioning issues, and they're not sure how to maybe best support them or help them. I'm going to leave, a good chunk at the end for people to kind of troubleshoot together. You can get some advice and input from me, as well as maybe some other members that are present here today that have maybe dealt with similar circumstances that maybe want to provide their input or how they solved the certain issue or problem that they've had. And then, of course, there will be time at the end for questions. But like I mentioned, if you have questions as we're going through the information, just feel free to chime in. All right. Now, sometimes when I'm going through information, I can get kind of excited and talk fast at times. And so I'm going to be very mindful of that. If I start talking a little bit too fast, or if you need me to slow down, or go over something again with a little bit more clarification, also please feel free to give me that feedback as well, so that I can make sure that everyone is getting the information and that it's sinking in and we're not going through things too fast. All right, so this first slide that we're looking at focuses mainly on the frontal lobe. That frontal lobe is that front part of your brain. It's responsible for all of our most complex thinking. It is the last part of the brain to fully mature, and it is not fully matured until sometimes our mid 20s. Okay, so think about, teenagers, sometimes younger adults, college students that are a little bit more impulsive, make rash decisions, don't think through consequences, or are very disorganized in their own life. Sometimes the reason for that is because that frontal lobe is not fully matured. And so, similarly, when you have been through a brain injury where that front part of your brain has been injured, whether that's via stroke, via you hit your head, or you've had a brain bleed, there are going to be some consequences that come from that most complex part of our brain getting hurt. And that front part of our brain is responsible for a lot of important skills. Our ability to plan, to problem solve different solutions, motivate ourselves, think through, wise decision making, making good judgment, controlling impulses, not just in our behavior, but also with our words. It's responsible for a lot of social judgment and social skills as well, along with our ability to learn, our working memory, and how well we regulate our attention. And so those are a lot of important skills that we need in our day-to-day life in order to function, in order to be successful. And so if that part of the brain gets hurt at all, gets injured, there might be some impairments. And that's why executive functioning is such an important topic to focus on, especially in treatment. Because if we're not tapping into building systems or trying to strengthen those executive functioning skills, that can really affect our quality of life. So I'm going to move on to the next slide. Okay, so this is kind of what I touched on a second ago, that when that prefrontal cortex, frontal part of our brain gets injured, we might see some behavior from people that might look like really low attention. I can only pay attention for maybe 10, 15 minutes, or thinking through solutions, critical thinking, even thinking through safety sometimes is a little bit slowed. It's a little bit inefficient. You might see more emotional lability with a frontal lobe injury, where someone might be a little bit more quick to anger, easily frustrated, maybe has struggles with anxiety or depression a little bit more intensely. Those emotions are how we regulate them. It's all in the front part of our brain. And so when that's impaired, really affects our emotional health. So you might see some language difficulty as well, difficulties with expressing your thoughts in a fluid way or in an organized fashion. Again, you might see some impulsive behavior, impaired judgment that seems very out of character prior to the injury. You might see some behavior that seems questionable, or, this person never used to make rash decisions or lash out at me, and now they're doing that, more frequently. And so you're going to see some changes in behavior, and sometimes the opposite of that, where it's not impulsive, it's not lashing out, but maybe it's more apathy, where I just, don't really care. There's like this level of indifference. I'm not pushed two way or the other, just kind of don't really care too much about what's going on around me. And that motivation can be hard to find when you're in that kind of apathetic state. All right. Any questions so far? I see Ron waving his hand.
Yes. Ron, please unmute and ask your question.
My question is, you mentioned that we don't mature the frontal lobe until we're in the mid-20s. So if we have a brain injury at 65, do we start over or do we get a jump start?
Great question. Great question. Depends on the extent and severity of the injury. You're not starting from, the first step. You're not starting all over with that maturity. You're going to see more of this scattered kind of profile where maybe behavior is different. Maybe you're more impulsive, or maybe there's some problem solving challenges, but it's going to be intermittent. It's not going to be all of these areas that you're struggling in. Now, obviously, if maybe you have a more severe impairment, you might see a lot of negative changes in these areas. But no, that brain is going to heal back to, close to back what it was prior to the injury, but it might take a while. It takes a long time for the brain to rewire itself. It is more plastic when we're younger. There's some studies that have shown even in, middle young adulthood, the brain is still very plastic, meaning it can rewire and it can reheal itself. If you're in that, later stage of like 60s, 70s, 80s, there is going to be a healing process, but it might be a little bit slower. And it might take longer to get back to that baseline, if it gets to that. But you're not going to start over, like you're a child and you have to, fully mature that brain again. It's just going to learn to rewire. Does that answer your question? Okay. Great
We
question.
have a question from Kelly. She has her hand up. Kelly, if you would unmute, please, and ask your question.
I kind of have this opposite question of Ronald.
Mhm.
So for me, it was when I was 10. So I was young, and I guess the plastic was thin and malleable. So
Mhm.
am I supposed to be 100% now that I'm 37 years old?
So you had a brain injury when you were 10?
Yeah, I had a tumor removed from my left frontal lobe.
So when it happens that young, the likelihood that the brain can reorder itself and rewire itself, there's a higher likelihood that you can get to that full maturity. But that's not always the case. It's not a perfect science. Sometimes there are still some executive functioning issues, behavioral issues, mood issues that are long term. Again, it really depends on the extent of the injury and how much needed to heal. But the younger, the better in terms of prognosis for the brain to reheal and remature in a holistic form. Um, I don't know if that answers your question, but it should be able to, but it's hard to say for certain. There still might be some little weaknesses here and there.
Does it make a difference that I also am epileptic?
Mm-hmm. Mm-hmm. So if you're having seizures, that's like a little injury to the brain every time. So if you're having reoccurring seizures throughout your lifespan as well, or even through that developmental period, that's also going to affect how your brain is maturing and how it's healing. And so that kind of hinders the progress a little bit. Not to say that it's not going to fully mature or fully heal, but that does also kind of hinder it. Yes.
Okay, thank you.
Mhm. Okay, so getting to what is executive functioning. If you have a family member who has ADHD or maybe is on the autism spectrum, you might have heard of this term before. Some people have never heard of executive functioning and what it is, but I would say within the field of psychology, it's gaining a lot of attention, especially more recently. So I'm going to cover what is that? What does that mean? And Peg Dawson, I like to focus on her definition because she is a psychologist and a world-renowned executive functioning coach. She is a kind of an expert in this area, and so I used her definition kind of first. That executive functioning are all brain-based skills that are required for you to be able to execute and perform tasks. These are not to be confused with intelligence. Executive functioning is different intelligence. You can have intact intelligence, but impaired executive functioning. Okay, so the two are not the same. It has nothing to do with how smart you are as a person. Um, but it really affects how our brain kind of sifts through information and manages information. It's an ability really to organize output. How are we going to plan, solve, behave, all the things that we do to get things done in our day-to-day life. And it really affects how we are able to control ourselves and control our behavior. Um, I also included a definition from the Center for the Developing Child by Harvard, and they talk about executive functioning as self-regulation skills. They describe it as like an air traffic control system. So think about at the airport, the person in the air traffic control tower, right, is telling all the planes where to land, where to take off, sit if there's another plane coming through, right? It's kind of that organizational system at the airport that keeps everything moving smoothly. And so your executive functioning is the exact same way. It affects, what you're going to do, how you're going to complete a task, how you're going to problem solve when an obstacle pops up, how you're going to plan for the future, how you're going to build a routine where you can get work done and get home tasks done. It's basically our output system that affects how we make decisions, how we manage all incoming information in our brain, and how we figure out where we're going. I have a few different tables. I like to use these when I'm doing feedbacks with patients and we're talking about maybe weaknesses or areas of focus for treatment and kind of the main areas they might want to focus on. So there are different executive functioning skills, and this table, this little circle, I think nicely breaks down what those executive functioning skills are. So we have attentional control, how well we control attention, cognitive inhibition, which is a mouthful. What that means is your impulse control system, how well you can put the brake on and stop yourself from doing something that might be impulsive or maybe rash. Um, it also includes working memory. So if I were to give you a phone number right now and I asked you to recite it back to me, that would be you using your working memory skills. So when someone is telling you you have an appointment tomorrow at 2 o'clock, or this important celebration is coming up this weekend, your ability to hold on to that information, to use it, that's all part of your working memory. So if that's impaired, a lot of information is going to fall through the cracks. Another big executive functioning skill is just being flexible. Not just flexible in your thinking, but also flexible in your behavior. So some people might be described as more rigid, meaning they get really stuck in one line of thinking and it's really hard for them to shift out of that. Or they're kind of stuck trying to use one solution to a problem and they really struggle to think of new or novel solutions. That all is part of being very flexible in your thinking. So that plays a huge role in problem solving. Um, Planning and organization, which we're going to be talking about, how we stay organized in day-to-day life. We touched on problem solving, and then the last big piece is emotion regulation. We don't realize how much of our ability to manage big emotions, anger, sadness, frustration, grief, how that is fully almost, completely controlled by that front part of our brain. So being able to adapt to hard circumstances, being resilient, those are all skills that come from, our ability to have those executive functioning skills. So if you've had an injury, you might have some challenges in certain areas, maybe more than one, maybe just, a few areas. Um, but when people say executive functioning, this is what they're talking about, these different skills. Okay.
Emily,
Yeah.
Dr. Kade, we have a hand raised. Let me see here who was first. I am sorry, I didn't catch who. Oh, there we go. I'm not sure who raised their hand
That
first.
was me, Rachel.
Okay, please,
Yeah.
thank you. Thank you, Rachel. Please go ahead.
So my question was, I didn't have like a frontal lobe brain injury. Mine was in my brainstem, but I
Hmm.
feel like I do relate to like a lot of these issues. Like I do have ADHD, so I don't know if it's more related to that or the brain injury can also affect, like, even if it wasn't in the frontal lobe, the brainstem could also have those issues.
Yeah, great question. So let me touch on brainstem. It possibly could, because neuropsychologists are realizing that our brain, even though we have these main areas, main lobes, where different skills are kind of mostly located, our brain kind of works in a network model, meaning our different lobes of the brain, our different parts of the brain are constantly communicating with each other and sending each other information. So if one part of the brain isn't working too well, it's going to struggle with maybe sending messages or getting information through to the other networks in our brain. So that could be a part of it. But I also want to touch on the ADHD piece, because when you have ADHD, it is a neurodevelopmental disorder. What that means is you're born with it and you're always going to have some challenges with attention regulation and executive functioning. And why is that? Because when you are diagnosed with ADHD, what it means is your frontal lobe is not going to develop normally compared to everyone else's. It's going to be more impaired. Even when it's fully matured, as we talked about in the mid-20s range, it's still not going to work efficiently. It's going to struggle with these skills lifelong. And as your brain matures, it gets stronger with these skills, but may not ever get to a point where it's fully mastered them or it can fully execute them easily. And so that's how ADHD can be so impairing. It is a disability, because your frontal lobe's impaired with ADHD. That's the part of your brain that's not developing at a normal rate. So that if you have someone with ADHD and they struggle with these things, memory, regulating emotions, being impulsive, very disorganized, that is likely why.
And Dr. Kade, thank you for answering that question. We have another hand up. Trish, if you would unmute.
Okay, hopefully I can remember them. One is, since I've had my brain injury, it seems like whenever I get on the computer and I try to work on the computer, I always push a button and mess it up and then have to do it like 3 times. And my curiosity is, what part of the wheel would be that experience? What would be the
It's a button you don't mean to hit when you're on the computer.
I either hit a button or I delete everything that I've done and I have to redo it, or I push the wrong button, or I mean it seems like I always do that. It's like I've written something and I delete it by accident, or I do something else and it's gone, or it just seems like I'm redoing whatever I do on the computer at least 3 times. And drives me nuts, but that's what reality is right now.
Right.
So
Well, if it's an accident, if there's some sort of button you're accidentally pushing that you don't mean to, that deletes everything on the page or deletes what you had just logged into, that could be more of an inhibitory control issue, that impulse control. But it could also be behavioral planning as well. Because when we're sitting in front of a screen and we're typing or we're doing something that requires a sequence, right? That's your ability to kind of stop and think, if I push X, Y, or Z, or if I push shift, something else, command, control, whatever, things you might be using on your computer, that requires you to quickly and efficiently think through the steps. And so if that isn't happening fluidly, there might be some errors that are happening in the process where you accidentally hit something, or you hit, a button you didn't mean to press, and then the whole system, gets thrown off. So yeah.
it's just like clockwork. Whenever I work on the computer, that and then it's gone, or I do
Yeah.
something. It's crazy because I used to be fluently working and now it doesn't happen that way. And then my other question was, when you're in extreme grief and stress
Mhm.
and you had a brain injury, what is the difference of coping with that versus someone who hasn't had a brain injury? What's the difference with that, with the because I'm noticing that there's even more apathy and more lack of motivation and more depression and more just like with the memory loss, it's really, really freaky to go through pictures and see people that I don't have a clue who they are or what they were part of my life, or going through the grief process. And it's it's harder to process it because I don't have that memory of these people, that even contacts, like going through my contact list, and I'm looking at names of people and I know they were important to me at some point, but I don't have a clue who they are. And so
You're getting more at, executive functioning isn't related to, this would be probably a different part of your brain that's injured, which is, remote memory for important people, important events, people from my past. I knew them really well at one time. Now I'm looking at a picture and I don't recognize who this person is. Um, that's not so much working memory, but more so long-term remote memory. And that can be greatly affected by brain injury. It makes it really hard to pull up information from a long, long time ago. and to process it. Some of those memories might be gone and really hard to access. And then there's that complicated layer of grief. And when we're under emotional duress and stress, that also puts a huge burden on how our brain works. And it makes it even harder to work in, even if we didn't have the brain injury, it would still make it really hard to work fluidly and to work efficiently. Um, and so that also adds another layer that's going to make a lot of these skills tough to use and to access.
Thank you for your question, Trish. Kelly has her hand up. Please unmute Kelly and ask your question briefly, please.
Hi, my name is actually Debbie. My
Oh,
daughter Kelly is also on, and
okay.
for some reason my Zoom comes up as her.
Oh,
I just wanted to touch something on the ADHD. As my daughter had said, she had her brain tumor removed when she was 10. And she has and still does have a lot of executive functioning issues that simulate ADHD. But we were told that because she has because it was tumor related, that ADHD medicine actually wouldn't help. Does that make sense to you?
If I'm being honest, ADHD medicine could technically help everyone. It's a stimulant, meaning anyone who takes a stimulant is going to notice a benefit. They're going to be more energized, they're going to be more attentive, they're going to be better able to function with those executive functioning skills. And the best treatment for ADHD, regardless of the type you have, if it's more inattentive or more impulsive, hyperactive, a stimulant medication is typically the most evidence-based treatment
Can,
for ADHD.
can
But
you?
I
Because
also take,
I was just texting her about this. Can she take a stimulant medication along with a seizure med?
Because I'm not a psychiatrist and I do not
I know.
prescribe medication, I'm not going to tell, just for competency in terms of kind of staying in my lane. I would say if you're wondering, can you take an ADHD medication with a seizure medication? I would refer you to talk to your prescribing psychiatrist or physician about how
Okay.
to interact. Um, I have heard of some people taking both, but again, I'm going to leave that up to your prescriber who's making those medical decisions and maybe collaborate with them.
Okay. Thank you very much.
Yeah, of course.
thank you for your question, Debbie. I have a couple questions that came in the chat from Elena. She had a curious question about how trauma slash PTSD is related to executive functioning. Is that in some ways like a brain injury, and why there's an overlap of symptoms? That's the first question.
Great question. I'm gonna try to answer this as succinctly as I can. When you have trauma, your brain is changed, but it's not an injury. It's a little bit different. Your nervous system is more sensitive and more vigilant. And when you have a hyperactive nervous system due to trauma, it affects your frontal lobe. Because if you're dealing with so much stress and angst from the trauma that's coming up, and trauma can kind of pop up as soon as we're around stimuli that reminds us of the trauma, our nervous system gets kicked off. And when that happens, it really impacts our attention and it impacts our ability to regulate emotions. So you might get a really big wave of fear, really big wave of frustration. You might shut down. It might be difficult to focus, to get tasks done, and it's because of that nervous system dysregulation. So that's what's causing the impairment.
Thank you for answering that. The second question from Elena, also about ADHD. Is it always a neurodevelopmental disorder? What about some of us who didn't begin to have symptoms until adulthood and only after enduring serious traumatic experiences?
So in that case, ADHD, you are born with it. You will not develop ADHD in adulthood. That's not how it happens. But when you've been through a very significant traumatic event, or maybe multiple traumatic events, or if you're just very burnt out from stress, life, managing everything, that does impact how your brain works, and it starts to tear down your brain. Stress, pervasive, long-term stress is going to start to eat away at how your brain works. The energy, your executive functioning systems, it makes it less and less efficient. So ADHD, yes, it is always neurodevelopmental. You will have it at birth. Now, sometimes because parents are taking care of kids, right, in their early developmental years, even in the high school years, they're managing a lot of things for them. Sometimes you don't see the struggles until adulthood or until college, because that's when the child is then left, or I should say young adult, is then left by themselves with no one checking in with them, no one planning their schedule, no one telling them what chores or tasks to do. They're left alone. And then they realize, oh my gosh, I can't navigate, I can't be organized. I'm not sure how to plan a goal and to execute it. So sometimes ADHD isn't fully recognized until adulthood, but that person has had it their entire life. It just was maybe it flew under the radar.
Thank you for your answer, Dr. Kade. And thank you for your questions, Elena. We can move on now.
Okay. All right. So, big question I get a lot in my practice is, well, okay, I have executive functioning issues. How do I deal with that? How do I strengthen that? What are some strategies? What am I supposed to do to make this part of my brain work better? So that I can, be more accomplished or achieve what I want to achieve. And so here are some just day-to-day activities that do help strengthen executive functioning. There's been some studies that have shown that these are tasks and activities that will help those parts of the brain. Things like the arts, being creative, painting, doing theater, doing a dance class, doing an improv or comedy class, doing things like sports, especially things that require you to think ahead, to plan your behavior and moves. Think of something like soccer, basketball. That requires planning and that requires strategy. There's also been a lot of studies that have shown martial arts, things like Tai Chi, the practice of Tai Chi, helps to strengthen executive functioning because you are practicing the skill of being very self-controlled and disciplined and doing slow movements, right? And that's good for the brain. It helps the brain learn to kind of think through behavior a little bit better. Things like cooking as well. If you're cooking from scratch, right, that requires some problem solving and some creativity. Or things, even caring for a pet, having a dog at home that you have to take care of, take on walks, figure out how to feed, build a routine for that animal. These are all activities that require you to plan, that require a little bit of flexibility, some problem solving, and maybe some perseverance. So these are just some ideas. Yeah.
Thank you for sharing that, Dr. Kade. I also want to mention about the Brain Injury Association has a movement class called Think Tall, Don't Fall, which incorporates Qigong and Tai Chi as well as brain gym for our survivors. And it's good to know that it is beneficial to their brain as well.
Perfect. That is a perfect segue because I had a quick slide on Tai Chi. So if you go to one of the events where it sounds like they're practicing these skills, these are all of the benefits that come from Tai Chi. Better sleep, better cardio, better balance and flexibility. It can help with different medical conditions. It can help with chronic pain. It can reduce your anxiety and depression. And so there's a lot of not just mental, but physical benefits that come with these types of practices. So I would highly recommend if you haven't tried one of those classes yet, definitely, see how it goes, try some of the skills, see how you feel after. Okay. If, activities, that's kind of one option that you can go down that road, do some classes, but there are also a lot of training apps, brain training apps that exist to also help improve impulse control, planning, problem solving, regulating attention, working memory. And so these are the four apps that I typically will recommend when I'm doing a feedback session and we're talking about treatment and we're talking about next steps. These are four that I would recommend: Elevate, Cognifit, Peak, Brain HQ. specifically peek in the down left corner. Those are the different areas and tasks and different games you can play to help with different executive functioning skills. So, like memory, focus, problem solving, even language. They have some language exercises that might help with not just receptive language comprehension, but also being able to kind of express your thoughts clearly. So, there's a lot of benefits to investing. I can't remember what if there's a cost or a subscription for some of these. They might be free, but I can't remember exactly. But you can look them up maybe later on if that is something that you think would be helpful for you or maybe a family member that you have. Okay. Okay, so we're going to move on into, let's see, some different SMART goals. I'm going to touch on this. I'm sure many of you have heard of this before. They cover SMART goals. I think, we've heard it at least maybe once in our life, either in elementary, maybe high school or college. But for organizational purposes, you need a SMART goal. And what does that stand for? Specific, measurable, attainable. It's something that could be accomplished, relevant to your own personal goals or values, or something you're trying to build, and then time bound. It needs to be very specific in terms of what does that goal look like in terms of time and how long is that going to go for. Oops. All right. So I'm going to touch briefly on action plans. These are something that executive functioning coaches focus on when we're trying to build a new skill or when we're trying to maybe set a goal of something we want to work on and improve. So these are just some open-ended questions. I won't spend too much time on it because we have a little bit of time at the end if there are some people who want to explore goals and maybe get some advice or some help with those. I'm going to focus on just an example. So this is one that I put together. This is a real example for myself. So my goal this summer is I want to increase my physical stamina. So what that's going to mean is going to the gym, right? But just saying I want to increase my physical stamina, right? That's a pretty open-ended statement. And so what a SMART goal does is it objectifies it. We make it very, very detailed and specific. So here is how I would break that down. Specific, what am I actually going to do? I'm going to go use the stair stepper at the gym. That's going to be how I'm going to increase endurance. Measurable, what does that look like? That would be possibly 3 times a week for 30 minutes. I'm going to use the stair stepper at the gym. Attainable, something that is actually feasible, something that can actually be accomplished. We don't want to set a goal that's unrealistic for ourselves. So I put that I would go to the gym Monday, Wednesday, Thursday. Those are my 3 days to get my 30 minutes. Relevant, attaching that to a greater reason, a greater purpose. I'm planning to hike the Inca Trail at the end of the summer. And so that is kind of my relevancy. This is why I'm doing this, is so that when I'm up in the Andes Mountains, I can last. I won't become too exhausted that I'll be able to finish the trek. And then time bound by August 15th. This is when I'm going to stop my training because that's when I leave for the trek. So that is just an example. And we can touch on these if people want some help setting their own goals, but that is what a SMART goal would look like, kind of broken down. All right. These are some questions to help with motivation. I hear a lot from patients that motivation is what they struggle with the most. Or they talk about their child has no motivation to want to improve themselves or to do homework. And they're trying to figure out how to help them kind of improve their quality of life or get to what they want to achieve in life. And so these are some questions that might help to just kind of trick the brain into that intrinsic motivational piece where we want to do the tasks that might be boring and might be unfun. So think about, why are you working on this goal? Why do you want to improve this thing in your life? What's the greater purpose? What's the greater meaning behind it? What benefits will you get? What are you going to get from this? What are going to be the good outcomes that will come from it? What strengths can you use? Often we can get caught up in just the deficits that we have and the weaknesses. And so it's important to also consider the opposite. What are the skills that I have or the strengths that I can pull from to help me with this goal? I really like the question, how are you going to feel once that goal is accomplished? And the reason that that question is so important is because it takes you into the future to when that goal has been accomplished or when that really boring long task has been done. And you think about, oh, that is going to feel amazing. I'm going to be so accomplished. It's maybe going to have these positive benefits in my life or with my relationships. And so when you can envision yourself in that headspace in the future, when the task is done, it's going to maybe push you a little bit to want to get there. You want to have that vision come to fruition. So that can be motivating. And we're going to touch on rewards in a second and how we can use those as well. All right. These are just some positive affirmations. Keep in mind, a mindset is huge for resiliency and huge for organized goal setting. Often with injury, when you're a survivor of an injury, there can be a lot of negative, cognitive thoughts that kind of come into your mind, a lot of negative thoughts. And it can be hard to combat them, challenge them, think in a different way, right? Because our brain wants to protect us. So it will automatically go towards the negative most of the time. So reminding ourselves of, I haven't achieved this goal yet, but I will. Yet is the important term there. And that's also important to use with kids when they are learning new skills, or maybe they're doing math homework that's really, really hard. You tell them you haven't mastered it yet, but you will. Keeping in mind that everything you're doing is good enough. Even if you feel like I'm falling short of my personal expectations, I'm falling short of where I wanted to be after, maybe going through months and months of physical therapy or OT or speech therapy, you showing up and you just doing what you can every day, that is good enough. So I'll leave these here just for time's sake. I won't go through every single one. But I did send out the slides and they can be sent to you all after this. So you can take a look at some of those positive affirmations. I think it's good to have at least one or two that you can go to just to, it's not going to make everything positive or make everything better, but it will help your brain kind of just reorient itself more towards thinking about good outcomes and things that you can do. All right. Okay, so before we get into organization, I'm going to touch on how do we take a goal, a big goal, or something that we want to do, and break it down into something that's manageable. Often after injury, there are some things that we maybe struggle to do or don't do as well as we used to do prior to the brain injury. And sometimes breaking things down can be helpful for some of those tasks that used to be so easy and now take a lot of energy and a lot of time and motivation to get accomplished. And this can also be used if you have ADHD or if you are working with a teen or a young adult who is struggling with these things. So if I give a broad goal, clean house every day, right? Which is sometimes maybe we tell our kids to do or our teenager to do, clean the house every day. Well, what does that mean? What do you mean when you say clean the house? Right? We have to break that down sometimes a little bit more. So if we break it down smaller, it might mean doing the dishes, sweeping and vacuuming, making the bed, mopping the floor, right? But for some individuals, even that can feel a little bit too much. Well, I don't know, what is the first step to sweeping or doing the dishes? That just sounds really, really overwhelming. And when we get into that overwhelmed state, what are we going to do? We're going to procrastinate, we're going to avoid. And so when we're overwhelmed, we have to break it down even smaller. Okay, so let's just take the example of doing the dishes. We're going to go around the house, every room. We're going to pick up all the cups, bowls, plates, right? Then we are going to set them on the counter next to the sink. Then what we're going to do, and this might vary depending on if you're using a dishwasher or if you're hand washing. I'm just going to use hand washing as an example. I am going to first wipe and clean with soap and a rag or maybe a sponge, all the glasses and the cups. Then I will do the cutlery, the forks and knives and spoons. Then I will do plates and bowls, and then I'll do any big cookware, pans, pots, if I have those left over. Then after that, what am I going to do with all those items that have just been cleaned and wiped down with soap? I'm going to take a towel and I'm going to dry them, right? And then I will put them away in maybe the reverse order. I'm going to put away the big things first, the pots, the pans, then the plates and the bowls. Then I'll end with the small stuff, the cutlery and the cups, right? And then that last step might be, then I clean down the sink. I wipe it down with a rag and some cleaning spray, so it's all nice and clean, right? For some people, their brain might automatically break down a task like that, clean the house or do the dishes automatically. That's when you have a good executive functioning system. Your brain is automatically starting to think about, I do this step, then this step, then this step. But if you have a brain injury or if you have ADHD, it might not be so obvious. And I think sometimes that can be the frustration when we're working with maybe adults with ADHD or adults who have been through injury, where that fluid kind of sequencing line of thinking does not come naturally. And so that's why breaking things down sometimes makes a difference. And it also makes the task feel a lot more manageable and less scary and less overwhelming. And so if there's other areas, other tasks that you're struggling with, breaking it down into teeny tiny steps is going to help improve your ability to actually execute and to get it finished. Okay. Any questions before I move on?
We have a question from Ron. We see you, Ron. Please unmute and ask. Thank you.
Are there times, I have situations where sometimes my executive functioning comes automatic, but there are days that it doesn't come. I have difficulties of deciding what to do first and what to do second and creating a sequence.
Mm-hmm.
Is that regular, or there are conditions such as being tired or underfed could make one day you're very good and the next day not so good?
Exactly. Yeah, I'm so glad you bring that up, Ron, because there are external factors that do affect, as we talked about, our executive functioning system. So earlier we had touched on grief, and when you're under mental duress, emotional duress, that affects it. But also, if you're not sleeping well at night, that also affects how well you can execute tasks or think in a sequential way. Or if you're not eating, right? If you're really hungry, your brain's not going to be working very fluidly with that frontal lobe. And so there are those pieces that affect it. And then sometimes just day to day with our energy levels, how well rested we are, how much stress is that we're dealing with day to day, that's going to affect how successful we are in our ability to use those executive functioning skills. And if you have a family member with ADHD, as we talked about, that inefficient frontal lobe, one day of the week, they might do something perfectly. And the next day you give them the same task and they really struggle to execute it. You're like, that doesn't make sense. You just did it yesterday. But that's the impairment of ADHD or impairment of executive dysfunction, is that it's not consistent. It's very inconsistent. And so you might show up differently day to day. That's very common. Okay, moving on to some rewards. We often think, when we think of rewards, we think of kids, right? We think of children, that if you get your chores done, I'll take you out for ice cream. Or if you clean up your room, you can go play with your friends in the neighborhood, right? But rewards are just as important with adults. And it's very, very important if you are setting a goal for yourself and you know it's going to take time, you know it's going to take energy, you know there's going to be some boring or unfun stuff that you have to do for it. Those deserve rewards. So I'm a big advocate for rewarding yourself, even if it is small. And not just rewarding yourself for the big outcome at the end, but rewarding yourself for the little steps along the way. So I'll just use myself as an example. Um, I will typically use beverages as my own reward, whether that's buying a smoothie, going to one of my favorite independent coffee shops and ordering my favorite drink. If I have to do some work that I'm not looking forward to, that beverage, usually, if I know I get to have that, it usually will get me motivated. It will get me moving. But rewards are going to look very different depending on the person. It might be a social reward, it might be a weekend trip that you treat yourself to, a staycation at a hotel for a night, or maybe you take yourself out shopping and you buy yourself a new bag or you buy yourself a new outfit. I think it's very important that if you are working towards goals, you have to constantly be rewarding yourself. Otherwise, it's hard to keep up the motivation. Um, so if there are things that you know you enjoy just naturally, whether food, hobbies, use those things as reinforcers for the stuff that you have to do that maybe you don't like or you're not looking forward to. Okay, so moving into organization, which is, you know, kind of the main topics for this presentation. Next, we are going to talk about the barriers and the setbacks to being organized. And on the left side of this page, I have some different barriers, and then the antidotes, things to manage those barriers. So one is distractions, um, which in day-to-day life, there's a lot of distractions just naturally, especially if you work from home or if you have a big to-do list, if you have kids that you're taking care of. These are all distractions, things that pull your attention away from maybe what you want to be working on. So if possible, trying to minimize distractions requires environmental modifications. What that means is you create a dedicated space where you try to minimize electronics. There's no TV in the room. Your phone isn't sitting next to you. Maybe you're wearing noise canceling headphones, which is what I typically will use if I'm doing some work or I'm writing, to kind of minimize getting pulled away. And distractions are going to come up just naturally. There are things that are going to pop up that we do have to address and we can't just ignore, that we do have to step away from our task and address it. And that's totally fine, as long as at some point we are redirecting ourselves maybe back to the task. And we'll talk about that too. How do we do that? Feeling overwhelmed. I notice that with a lot of adults that I work with. Often that will be the main source of procrastination or just task avoidance. They're feeling burnt out. They're maybe feeling anxious about the future. Maybe they are dealing with some heightened stress in their day-to-day life, or maybe even trauma. And at that point, the brain just wants to shut down, right? Because it's too overwhelmed with everything it's trying to manage. And so to protect itself, it will just say, screw it, I don't want to do anything. And so when we get into that point of just overloaded, overstimulated, don't want to do anything, but we still have this task that is important to do, committing to a very small time frame is the easiest brain trick to get us to at least make a step towards that task. So I put the kind of increment of 15 to 20 minutes because for most adults, I would say that is manageable to commit to an activity for 15 or 20 minutes. For some, though, that might be too long. It might be I have to just commit to 5 or 10 minutes at a time. And that's really all I have energy for is 5 to 10 minutes. That will usually get you to commit to that time frame. However, it is important to allow yourself to walk away after the time frame has elapsed, right? Because it's important to kind of set those boundaries if you are struggling emotionally or energy wise to take that time for yourself. But I bet that after you've done that 10 or 15 minutes of work, you're going to feel productive. You might even feel more energized to continue the task because now you're on the roll, right? Now you've started something. And once you start something, you're more likely to follow through with it. But it is okay if it's just in very small increments on a day-to-day basis. All right, perfectionism is another big one that I see with a lot of adults that have high expectations for themselves. Um, Often they set the bar really, really high, right? Because they have a goal and they really want to see it achieved. But with that perfectionism, it causes a lot of stress because they have all these minute little things they want done perfectly, and it eats up time and it eats up energy, and they burn out because they get to a point where they've spent so much energy trying to make every little step perfect that the whole task gets lost in translation. So it's important to remember to strive for excellence, not perfection. And remember that done, a task completed, is better than a task that is not completed. It's better than perfect and incomplete. So I know many people can kind of get stuck in that perfectionistic mindset. The other last barrier to organization that I have on here is time management. Oftentimes people will underestimate how long a task is going to last. They might have a goal, I need to clean the garage. It'll probably take me an hour, right? And then they realize after a full day of cleaning, it's still not maybe perfectly organized, or they haven't gotten through everything in the garage that they needed to clean. And so managing time comes down to trying to set a schedule, and again, breaking down those tasks into those very small increments. Same thing with the dishes. Break it down into small little bits. Prioritize maybe what's the most important, but understand that sometimes the full task isn't going to be done in one fell swoop. It's sometimes going to take a couple of days or a couple of sessions. And that's okay. That's okay. I think it's perfectly fine to have those high expectations, or try to accomplish a lot in one period if you can, but it's okay to give yourself that grace if the task is not completed as quickly as you had expected. All right, moving into some strategies for overcoming setbacks. And these, when we have a goal, when we have disorganization in our life, there are going to be setbacks. They're going to happen. It's pretty much a guarantee. Nothing is going to, well, if you're lucky, things might happen seamlessly and smoothly with no obstacles, but in reality, that's typically not the case. And so when setbacks happen, when you get off, disfocused, or something comes up, family member has an issue that you need to address or care for, how do we deal with those setbacks to our goals? The first is trying to embrace a growth mindset. Growth mindset is a term where we believe that our skills can be developed and improved, that the abilities that we have are not fixed. We're not stuck with them. We do have the opportunity to build skills and get better at things. That's what a growth mindset is. So reminding ourselves of that, it helps with reframing failure. So when a goal doesn't get accomplished, maybe we're, just trying to get our home clean and it's just not happening for whatever reason. It's important to not see those as failures, because it's not a failure, right? We might have to kind of look at the situation and think about what went wrong. What could I do a little bit differently so that I can get the house clean? But that does not reflect a failure on your part as a person. We're human. Our brains sometimes betray us in many ways. And it's important to recognize that, and to not kind of adopt that shame onto yourself. I encourage a lot of self-compassion. As I just kind of mentioned, we're all human. We're not perfect. Things are going to come up, maybe that we don't handle in the best way, and that's okay. It's important to forgive ourselves and continue to give ourselves those positive affirmations and to build ourselves up, even when we're going through something that's difficult or maybe challenging.
We have a question,
Yeah.
Dr. Jade,
Mhm.
and thank you for that. So we don't end up in that stinking thinking mode.
Yeah.
Remember to be nice to ourselves. Kelly asks, what if you struggle knowing what's more important?
Mm. We're going to talk about that in a second, but I'll touch on it now. Um, there's this term called triage, which is something they use in emergency departments. I'm sure some of you have heard it before. Or what is it when a nurse or a healthcare team triages different patients in the ER, right? They are prioritizing those who need the most help, those with maybe the most severe injuries or need immediate medical attention, right? Or maybe they need to go into surgery. They're figuring out where do those heavy needs lie or those really severe needs lie. And then they will address those first, those patients that are in the most critical condition. And then for those who maybe have, a sprain or maybe just have a cough, those might be pushed back a little bit in the line of prioritization. And so that is a similar concept you can use in your day-to-day life in terms of priority. What tasks you feel are the most critical, the most severe. So I'll give you an example. Probably paying your bills would be a top priority task, right? Because what if you don't pay the water bill? What if you don't pay the electric bill? Services get cut off, right? So that might be something you prioritize more than putting the dishes away, right? If your house, let's say the dishes are stacking up pretty heavily, maybe to the point where the entire sink is full, you've got dishes on top of dishes, and now they're spilling out to the sides of the counter along the sink. That's probably going to be a higher priority than sweeping the floors, right? Because now I've got this huge mess that is starting to expand across my living space. So that's what I need to prioritize first before maybe I make the bed or sweep or whatever else is on your to-do list. So whatever is the biggest priority is something that you will have to um, figure out um, in terms of, what do you think is most critical or most severe? So really, it would depend, to answer your question, it would depend on, well, what is the list of things you need to do? And then we would maybe organize what's most pressing. So I'm sorry, I'm not sure if that probably doesn't answer your question, but it would really depend on the tasks that are in front of you and figuring out which ones are most critical or most important to address first.
Did that answer your question, Kelly? I believe so.
Okay.
Yes, thank you.
All right. Um, okay, so here's some more strategies for overcoming setbacks. Let's say, the dishes were stacked up all over the counter, huge, huge pile of dishes. And you meant to get them clean today, but it did not happen. Tomorrow, you might have to ask yourself, what happened yesterday? Was I just like physically spent? Was I exhausted? Did I just not have the energy? Or did I get pulled in a different direction with work? Did I get preoccupied with something else and that got in the way? And maybe how can I minimize the likelihood that that's going to happen again today so that I can get these dishes put away and cleaned. So a little bit of analysis, a little bit of looking at what went wrong or what were the barriers that happened so that we can be aware and hopefully reduce the likelihood that they're going to reoccur the next day. It might mean adapting. It might mean this is what it would look like with the dishes example. Instead of doing all of the dishes, I might just start with the dishes that have now compiled onto my counter space. I need to get those dishes off. So I'm going to clean those first. I'm going to put those away. And then maybe I will tackle the sink dishes tomorrow or in a couple of days. But I just needed to get those dishes that were spilling over, cleaned up. So that might be adapting the goal. And again, focusing on one step at a time if it feels overwhelming. Breaking it down again. I'm just going to do cups, then I'll do cutlery, then whatever else is next. And so apply these examples to maybe whatever you're thinking for your own tasks or your own um, things that you're trying to kind of organize in your day-to-day life. This is a term that if you have ADHD, if you have a family member with ADHD, Um, this is a skill that more people are talking about. It's called body doubling. Some people have heard of this, some people have not. When we get stuck and we can't get organized or we can't get a task done, it sometimes does help to have someone in the same space as us, or sometimes on the phone or on FaceTime, because just the situation of having another person in front of you, observing you, maybe listening or watching what you're doing, maybe not helping you through the task, but just kind of there in your presence, it does help improve motivation with someone around. You can also use the other person as a accountability partner. So someone who might check in with you. Hey, did you get, your house cleaned up? Did you get your car washed? You get your groceries? Whatever it is that you're working on, maybe having someone just to check in with you sometimes helps. Because most people will find if I know that my friend is going to send me a check-in text 3 days from now, well, I had better finish that task because I want to give them good news, right? So when you have an accountability partner, you're more likely to get started and a little bit more motivated on that task. So body doubling for some people is very, very helpful. They find that they're a lot more productive. And they also find that having someone around sometimes just makes the task less overwhelming and more enjoyable. They might have less anxiety with just someone sharing the space with them. So this can be a tool that I think can be applicable to any age, any type of injury, for any sort of task that you're trying to get finished, but you're having some challenges with getting started. This can be very, very helpful. Right. I'm going to keep moving through here so that we have some time at the end for troubleshooting and discussion. This is kind of what I touched on earlier, where we really want to celebrate progress, not just the end outcome. So think about those who have successfully summited Everest, right? Which is a huge accomplishment, right? But they wouldn't have been able to get to the summit without those millions and thousands of steps and all those little camps that they needed to get to over and over again through training, to get to the summit. It's the smaller goals, those broken down steps, that really is what gets you to success, right? So again, each step that you make, each thing you're doing that helps you progress towards that goal should be rewarded. It's the journey that really makes more of the difference. Yes, the end outcome feels great, but to build true resiliency and to, allow ourselves to feel that accomplishment, it really comes in the small wins and the small little achievements along the way. All right. These are just some books that I recommend for executive functioning. Brain Hacks is my favorite, by Dr. Honos Webb. And it's a very short book. It's very small, so it's not overwhelming when you purchase it. And she goes through chapters, and each chapter is its own executive functioning skill. And she breaks down in bullet points ways to improve and use strategies for those different executive functioning skills that we talked about at the beginning of this presentation. And then these are two other experts in ADHD and executive functioning, Dr. Peg Dawson and Dr. Russell Barkley. All right, so again, I sent out the slides so you guys can take a look at those later. These are some of the brain hacks from that book that I just mentioned. Some of these we have already talked about. So I won't spend too much time. We talked about body doubling, creating an organized space, high priority tasks. I'm going to move on from these. We talked about triaging. So again, ordering those tasks in level of importance and urgency. Something else I wanted to mention is our brains are not meant to multitask. So when we're doing maybe 2 or 3 things at once, our brain is not doing all of those tasks at the exact same time. It's actually rapidly switching between what we need to do for each task. So if you're, sweeping at the same time you're talking on the phone, at the same time you're trying to plan an event, right? Your brain is constantly switch, 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 moment to moment to get those tasks done. And that requires a lot of energy. And so that can put a lot of stress on the brain to try to multitask. So as much as possible, when you're sitting down to get organized, trying to silence distractions, putting your phone on do not disturb, turning off the TV, only maybe opening social media when the task has been completed, right? Doing these little modifications can help us make a little bit more progress and not get so sidetracked. Okay. All right, here are some apps for organization and routine. Again, the slides, you'll be able to look at these later. I'm going to just show a couple of examples. This is the Skylight digital calendar. If you have many people in your household who have different appointments, different schedules, they've got sports games in the evening, they've got different classes they have to get to. This can help organize everyone's schedule in the same place. So everyone knows kind of what's the game plan for the day, what's coming up on the weekend, and can kind of help plan for that. Here's another one, the Sun Sama app, and I'm just giving you some screenshots of what they can look like. This kind of helps you just organize and prioritize different tasks. You can put them on your calendar, even if it's, your lunch break. Having that on your calendar sometimes helps you kind of track time a little bit better. And then here is another one, the Daily Routine app. I just like the way this one looks with all the fun colors. You can also build in different goals and steps for each goal. You can have notes, breaks incorporated into your routine. So if you're looking for something to help, track a routine day to day or help to track appointments, in addition to maybe a physical calendar, this app as well can help with just kind of planning and organizing your day. All right, so in conclusion, we've talked about executive functioning and how they can be impaired after brain injury, but executive functioning skills can also be practiced and they can be improved. So these are things we can actually build upon and incorporate into our day-to-day life. And then we have, you have this community through the Brain Injury Association of Arizona. I'm sure many of you have friends, family members that can kind of help support you, maybe help with systems if you need that extra support. And so there's a lot of tools and supports that we have available, especially in this digital age that we live in, to help with a lot of these skills. A lot of people are using AI too these days to kind of help build schedules, build systems, or just, for different tools that they need. Okay, so we have about 15 minutes left. So I'm going to open it up for questions and also open it up to if there are specific things you're struggling with that you want some advice or input on. And other people can also provide their input as well, or their wisdom and expertise. So I'll just open it up, and anyone who has a question or a comment or a story can jump in.
We have, it looks like a hand up from Kathy Lasusa.
Hi, thank you for your presentation today. It's been so helpful in making me not feel like I'm alone or crazy. I am trying to figure out what to do next and where to turn. I do have complex PTSD, ADD, depression, severe depression, and anxiety. I also have brain injury. I've either hit my head or been hit on the head 5 times